How are you? My name is Michelle Poliak-Tunis. I am the UW-Madison Program Director for the PM&R department. Super excited to be on this and hope that you guys get to hear a little bit about us. We decided against doing a PowerPoint presentation because you guys have been sitting for a long time, and I thought better to have my Associate Program Director, Michael Sewer, on to talk a little bit, Simon Wallace, our Chief Resident, and Delilah, our Program Coordinator, to answer questions and allow you guys to really ask questions live instead of thinking about them later on. So just a little bit about us. Like I said, my counterparts are going to talk a little bit more, but just so you know a little bit about Madison, home to Bucky Badger. We're all wearing red, Bucky Badger red. Madison's the second largest city in Wisconsin, 81st largest city in the US. It's home to over 260 parks and over 200 miles of multi-use paths and trails. It's been named one of the best small cities in America, and one of the #1 fittest cities in America. With regards to our hospital, UW-Madison Hospital, it's been ranked best hospitals in Wisconsin for numerous years through U.S. News and World Report, and the 6th for total research expenditures among the U.S. universities in U.S. News, World, and Report. That's just a little about UW-Madison. So let me pass it along to Dr. Michael Sewer, if he's on.
Yeah, excellent.
Great.
Thank you, Michelle. So for those of you who are looking at her, right above her head is, you got a duck. There's the Capitol. That's what we got to look at. There's 4 main lakes around Madison. We should have mentioned this, Michelle.
Sorry.
4 big lakes. She said 200 miles of trails, but that's only within the city. There's actually, a couple hundred miles of trails outside of that too. So the 2 main lakes, a lot of water sports, a lot of things to do just to stay active with that. But the real reason you're here to talk about the program. So I'll talk a little bit about our faculty, starting with the most important one, Michelle Poliak-Tunis. She's our new program director. She does a little bit of spine half day a week, but she mainly works in the pain clinic doing procedures. Our division chairman, Nalini Segal, is also a pain provider. We have several other providers that do primarily spine musculoskeletal work. One of the interesting things about our clinics is that they're all very multidisciplinary. So I know that's kind of a hot topic, and a lot of physiatrists want that in their practice. And where I work, not only am I sitting next to one other physiatrist, I'm actually sitting next to a neurosurgeon, an orthopedic surgeon, a spine orthosurgeon. Down the hall, we have radiology, integrative medicine, sports medicine. So our UW team physicians are in the same clinic space as I am. Joint replacement, they're all in-house. Our pain clinic, which we have, three providers dedicated to pain, in addition to myself and Jim Leonard, who also primarily focus on spine. We have in that clinic anesthesia pain, so there's collaborations that happen there. We have addiction medicine, psychology, and psychiatry as well. So very, very multidisciplinary clinics there. And then when we look at our neuro rehab side, several providers at our Middleton Rehab Clinic who work daily with the physical therapists, the occupational therapists, prosthetics, orthotics. Everybody is in-house. So there's a lot of room for cooperation. When I was a resident many years ago, like 2 years ago, that was a really valuable thing for learning for me, which Simon will talk about. Having those individuals around who we can just walk over and ask these questions to, you're not going to be able to replicate that anywhere else. And just being able to know them on a first name basis is invaluable for learning. And I know Simon, I don't want to take too much of your time. He said he has like a 13 to 14 minute elevator talk. I don't know what kind of elevators he goes on, but that's what he has. My specialty really is dad jokes, which in impersonating my colleagues, and I was told strictly no more dad jokes today and no impersonating colleagues. So I should probably just stop here.
All right. Well, thank you, Dr. Sewer and Dr. Poliak-Tunis. I will definitely talk about. I just want to reiterate questions anytime. The chat is open. I am a native of Wisconsin. I grew up in Eau Claire, which is west central, in between the Twin Cities and Madison. And I left for school, and I came back, and I was very happy to come back to Madison for residency, especially after having rotated as a student at UW. It's a program that has 3 residents per class, and it's an advanced program, so there is no integrated internship involved. We do 3-month rotations, which has been discussed actually earlier tonight, and that was one of the things that I really loved about the program, actually, is that it gives you the chance to settle into your rotation and get to know the providers that you're working with and the clinics that they're in over an extended period of time. That also gives you an opportunity to have patient continuity, which is something I've experienced over and over throughout my residency here. As it is longitudinal, what this means for us, we have 3-month rotations where we have a 3-month rotation, our PGY 2-year, and then our 3-year, and then our 4-year as well. And I do feel like there's a great benefit in that if you're interested in inpatient rehab overall, or if you're just interested in being on faculty at an academic institution where you're going to be taking call, or at any other institution where you'll be taking call, it keeps you fresh on those inpatient skills. Our rehab hospital is a 49-bed freestanding rehab hospital on the east side of Madison. It's still, relatively close to the main campus. It's all in Madison proper. And it's also right next to a newer building called the American Center that has an inpatient service as well as outpatient ORs and that sort of thing too. So we work very closely with them there. As far as the clinics that we do rotate in, we cover all the bases in terms of the neuro clinic and spine clinic and pain clinic. And we hit those at different rotations throughout our residency so that, again, it's a longitudinal curriculum where you come back and see things over and over again, not just in one isolated burst. We do rotate at the VA for one of our rotations. It's not a dedicated rotation, but we do get exposure to that population. And the provider we work there sees a lot of different types of things. So another interesting rotation that we have is at the Central Wisconsin Center, which is actually kind of a hybrid inpatient and outpatient rotation. The facility itself is actually, it's designed for people who have intellectual and developmental disabilities. And we work in the short-term care unit there where we see sometimes children and then sometimes young adults. And they come through for various reasons where they can get all of their comprehensive rehab needs met at this facility. And that includes things like having a dentist on site, an audiologist on site, and even custom wheelchair manufacturing right on site. So a very, very unique facility, and having a strong background and interest in serving people with developmental disabilities, for me, that was a huge draw. Additionally, after rotating there as a resident, we also have the opportunity to moonlight there in their long-term residential facility. So it provides many opportunities to see things that you would not normally see in maybe more common rehab rotations. As far as our call schedule goes, we do take home call. I really wanted that because when I was a medical student, I had a daughter, and now I have 2 children. And for me, being at home is always preferable to being away from them at night. So for me, that was a huge plus. We have any weekend we're not on call, we have off, and we take fewer and fewer calls as we graduate up towards our PGY 4-year, and so there's also that advantage as well. People do talk about procedures and whether meeting those numbers is possible, and by far, I mean easily, we meet every number that we are required to meet and more. We have a dedicated EMG rotation, and currently at this point in time, wherein we get 200 procedures easily by the time that rotation is done. We also have no competition, even though we do have a pain fellowship here at UW. We don't have any competition with any of those fellows in terms of whether or not we can get the numbers and experiences that we need. So that's a great plus there too.
And Simon, I'll jump in there real quick. Just so people know kind of our experiences with this. When I was done with my PGY 2-year, I had 205 EMGs, finished with close to 500. As far as actual procedures go, I was at, I think, 900 and something when I was done. So yes, we have a pain fellowship, and that's often one of the questions we get. And Michelle and I are involved a lot with the pain fellowship too. And we've actually looked at all of these schedules and designed the schedules such that there's not a lot of overlap between the residents and the fellows. And so, when I was doing my pain fellowship, there was only maybe 1 day a week where I would overlap with the resident, but there was always 2 attendings there. And so you're never going to get your toes stepped on by the fellow and vice versa. And so there's always opportunities to get your hands-on experience, which I think is the most important thing as a potential resident.
Absolutely. And also speaking, I mean, we have our outstanding pain fellowship, but also speaking to the EMG experience itself, our former program director is now the president-elect of AANEM, Dr. Bonnie Weigert. And so not only do we have her in our division, but we also have several other neurologists who perform EMGs and even other rehab providers who perform EMGs throughout their clinics where we get exposure to it there as well. So really plenty of exposure. Other things that do come up in terms of questions, we have some supplemental things that we do attend. There's a P&O conference that we attend with other Midwestern programs in Missouri that we always have a wonderful time at. This year it was virtual, of course, but we miss seeing them in person. But it's also kind of a resident retreat for us too, just to kind of get out of Wisconsin and go hang out in a beautiful area during a beautiful time of the year. We have an annual cadaver anatomy lab where we can learn spine anatomy and that sort of thing, which is really informative for the spinal procedures. It just gives you that 3D view that you can't quite get from a 2D image when you're looking at it in the actual procedure center. And then Dr. Sewer is really putting together some outstanding ultrasound didactics for us as well, which we'll have to resume hopefully in the near future after COVID changes a little bit. We'd like to do that in person much more, but nonetheless, we have that opportunity as well. I just wanted to say a couple things about anybody who's interested. We've talked about pain as being a fellowship, but for those who are interested in peds, we have a great group of peds physicians. And then if you take the CWC experience into account there too, and looking at developmental medicine and that sort of thing, and then you have your 3-month elective time, if you really are strongly interested in peds, you can get 9 months of exposure to that field if that's something you would be interested in doing. Additionally, there's another program that we have through something called the Weisman Center, which is an affiliate of UW, and it's called LEND, which stands for Leadership in Education and Neurodevelopmental and Related Disorders. And this is as far as I know, we're the only residency program that allows our residents to participate in that and get certified in what is a truly interdisciplinary program where you're working with all different types of therapists and PhDs. And anybody looking into going into the field where you would serve people who have developmental and intellectual disabilities. And so it's quite an outstanding program that actually gears you towards not only the interdisciplinary approach, but also changing policy and trying to have effect on the way policy is driven. So a very cool thing that I've been participating in for the last couple of years. Besides that, people do volunteer in things like Special Olympics. Dr. Sewer and others have had a really strong presence at high school sideline events and that sort of thing. But I think those are all the big things that I wanted to hit in terms of residency highlights. And of course, if either of you want to jump back in here, or if Delilah wants to say anything more, we certainly can do that. And I see a question that just popped up here. We work with ABA professionals with the developmental rotations. ABA, what does ABA stand for in this case?
The behavior analysts.
Right. Okay. So for me, I have not had my PEDS rotation yet. I do know that they have a multidisciplinary clinic there. Applied behavior analysis is not something that happens at the Central Wisconsin Center. But I can't actually, Dr. Sewer, maybe you could speak to the actual PEDS rotation in terms of what kind of exposure to that.
Again, off the top of my head, I don't know if they actually work with any of the applied behavior analysts. The PEDS rotations themselves, one of the UW big things is they're multidisciplinary clinics. They work a lot with psychology and psychiatry and with other I don't know off the top of my head if they have any of the ABA professionals within their clinics, though. That may have changed. I did my PEDS rotation 4 years ago, though, so that may have changed since then.
And Rosalind is asking if we can repeat the certification. It's called LEND, Wisconsin LEND, and that stands for Leadership, Education in Neurodevelopmental and Related Disabilities. And what the nice thing about the way it's structured into our residency is that a lot of the requirements that LEND has in terms of getting that certification actually can be really just simply a part of your residency as it is. There is a research component to it, but as long as you're participating in some form of research that can be applied to that field, that part is essentially taken care of. And then there's some other really cool stuff, just, attending outstanding lectures with experts in the field, and then even visiting the Capitol here in Madison. And if you wish, you can visit the national Capitol and be present for policy decisions and actually present even policy propositions of your own.
And Simon, I'll jump back in here too. So just a little bit of my personal experience. I actually came up to Madison for residency and had no intention at all of staying. We planned on going back to Indiana. But once we have found up here, we discovered that it's really a family environment. Everybody is incredibly cordial up here, not only within the PM&R group, but within the hospital as a whole. The atmosphere that we have at UW, and I'm talking the hospital, the school, and even just the community, really, it can't be beat. So if you're looking for a place to train that's good to have a family, it's really hard to beat UW.
And I'll chime in also. So I'm the new program director, and when I joined faculty here 6 years ago, ironically, I trained in Baltimore, in LA. I'm from Texas. I never thought I'd be in the Midwest, and I'll tell you, it's a phenomenal program. And I know my family still says, "Isn't it freezing?" I said, "Yeah, but you get used to it." And our faculty are wonderful. Our residents are amazing to work with. And so it's been a joy to work with them and see them grow, and the fellows as well. So Hannah from MCW wrote rural PM&R medicine. So we don't have, Michael's already responded. There's some outreach clinics. However, we do get you do get 3 months of elective, and you can pretty much do anything you want within that 3 months elective time. So if you want to come up with something rural, that'd be fantastic. And that's usually your PGY 4-year. So there's definitely opportunities to do that.
Yeah, and I do an outreach clinic in Boston, which is 5,000 people. Jim Leonard does a clinic up there, and he also does one in Sauk, which is 10,000 people maybe. So some pretty small communities that we travel for those.
Something to look out for too. There's a program called AgAbility, AgAbility, and I think it's a national program, but there's a very strong presence here in Wisconsin. And I have actually been meaning to reach out to a gentleman who is one of the more prominent figures in that organization around here, just to talk to him about it, because its focus is really on actually accessible farming and accessible agriculture. So I'm not sure, if you have anything like that near Milwaukee, but in Wisconsin, I think there is a component. So you can look out for that too, just as a heads up. Yeah.
About 2 minutes left.
Great.
So high school sports, I'm the team physician for actually the defending state champion DeForest Norskies. I do their football and the wrestling. So there's always room for a resident with me. There's several schools around that are always looking for high school volunteers. And one of the UW team physicians actually oversees us. So if there's something that goes on, you have David's cell phone, you just call him. But there's always a spot with me on the sideline. And so there's that. Sometimes we'll help cover some of the, like the Ironman and the marathon and things like that, if you're interested in that as well.
So I want to go. So what % do fellowships? Probably a little around a third each year. There's maybe one per class. We've done pain. Michael is one of our pain fellows and now attendings. Most recently, our graduating class this past year, one is doing cancer rehab at MD Anderson. The other two are joining practices. And so those that want to do fellowship have matched. Nobody has gone unmatched, which is great. The protected didactic time. We have protected didactic time on Friday mornings. That start at 7:30 in the morning. From 7:30 to 8:30, we have didactics with faculty. So that can include journal club, that can be a clinical case conference, that could be grand rounds. And then from 8:45 to noon, you have protected didactic time that are given by faculty members, or sometimes, not very often, but the residents may participate in those as well. What else did I Oh, God, Michael's on it. See, this is what's so great. My associate program manager is answering your questions without even me paying attention.
I'm the associate to the program director, Michelle.
This is who we are. I mean, this is what you get. But the other thing I did want to add is we will be having opportunities for you guys to join our journal clubs once a month if you guys would like to. Delilah, you can reach out to Delilah. Okay. Well, so Delilah will have all of our contact information. She can send it to you guys.